All right, we're just going to bring a little attention to the iliotibial band or tract in this video right here. So the iliotibial band is a deep investing fascia that runs down the lateral aspect of the thigh. So a lot of times people will complain about pain, so we're trying to help you identify where this structure is and talk about the muscle tissue in the area. I'm just going to be palpating over top of her shorts in this. I found the ASIS in that anterior iliac crest. So there's a muscle in this area called the tensor fascia lata. You can look that up and watch our full palpation of that video. This muscle is attaching to the more anterior aspect of this iliotibial band or tract, and then in the posterior aspect is the muscle known as gluteus maximus. So that's attaching along that posterior iliac crest and the sacrum in this area, and it's going more into the posterior aspect of the iliotibial band or tract. So you have two muscles on either side pulling or tightening it up, plus it goes a little bit above that over glute medius all the way up to the iliac crest. Now this fascia is going to run down, as most people know, the lateral thigh, crosses the knee and goes into a bony landmark called Gerdy's tubercle right in this area. So if you can, I'm just going to show you skin versus a little bit more deep investing fascia. So if I'm just grasping this superficial layer right here, this is skin. This is not where the iliotibial band is. We need to go past that. So I'm going to sink in a little bit more. It's going to almost look like I'm in more a muscular layer. And I'm going to grasp this and start pushing a little more anterior posterior with the fibers. Now you might think this is vastus lateralis, but the easiest thing I can do is get her to extend her knee with a little resistance, and I can feel the muscle belly below, but superficially, especially right on my index finger right here, I have a dense tissue that's not contracting, and that's going to be some of this iliotibial band fascia. Now I can also try to lengthen it. I'm going to grab the leg, I'm going to bring it into extension. This really starts to lengthen out tensor fascia lata, and I'm going to drop this knee towards the table. So this is actually a special test that you might be able to read up on. And as I drop this leg, it puts a lot of tension across the iliotibial band, and one of the most common reactions, if it's tight, is this leg wants to extend because the iliotibial band is being pulled. So even from here, you can palpate down along that lateral thigh and get a really good sense of this IT band and where it is. And then again, you might want to do some fascial work to this tissue as well as treat vastus lateralis. But don't forget about that TFL and glute max at the top. So you can just see it's slightly raised here. Again, just a video just to help you identify and find and possibly treat this iliotibial band.